It's very easy to understand the general path of the frontal branch, which follows on Pitangay's line, which goes from the base of the tragus to a landmark 1.5 centimeters cephalad to the eyebrow. And that tends to be the general path of the frontal branch, but there's a lot of variations in terms of how many branches exist going to the frontalis and where exactly the frontal branch enters the frontalis. In general, the frontal branches are always situated in the region between the anterior branch of the superficial temporal artery and the eyebrow, within the temporal area on a two-dimensional basis, so that when you're dissecting in the temporal region cephalad to the zygomatic arch, it is very important to keep your dissection superficial to the SMAS because the frontal branch sit directly deep to the SMAS in that area. In this diagram, we're seeing a cross-section taken through the temporal region which shows the plane of the frontal branch. Once the frontal branch crosses cephalad to the zygomatic arch, it sits in the plane between superficial and deep fascia invested in subSMAS fat. Now the SMAS within the temporal area is termed temporal parietal fascia. The deep fascia in the temporal area is termed deep temporal fascia. And again, the frontal branch sits between these two layers. Notice that the deep temporal fascia in the region from the superior orbital rim to the arch splits to encompass a fat pad, and this is the temporal fat pad. As you'll see on the next video clip, when you're dissecting toward the zygomatic arch, say in a coronal brow lift or in a craniofacial procedure, it is safest to dissect deep to the deep fascia or deep to the deep temporal fascia within the superficial temporal fat pad, as this will give you one fascial layer of protection between your dissection and the overlying frontal branches. In this cadaver photo, you see the frontal branch as it transits the temporal region just deep to the superficial fascia, also termed temporal parietal fascia, in the plane between the temporal parietal fascia and the deep temporal fascia, encased in subSMAS fat. For this region, since it sits so superficially, if you go deep to the SMAS, when you're dissecting in the temporal area, you can get a motor branch injury. So it is very important when you're dissecting in the temporal region to stay either superficial to the SMAS or stay deep to the superficial layer of the deep temporal fascia. Thereby you're either superficial or deep to the path of the frontal branch. I think this will be clarified in the accompanying video segment. Just to orient you, here's the tragus, here's the brow, here's the frontal branch of the superficial temporal artery. We know that the frontal branches, no matter how many they're going to be, lie in this area on a line from the eyebrow to the frontal branch of the superficial temporal artery. Now notice that I have dissected the mesotemporalis. Here you have deep temporal fascia. We've dissected all the way down toward the supraorbital rim in the subgaleal plane, protecting the subgaleal fascia, and then as we got down toward the rim, we divided the superficial layer of the deep temporal fascia and dissected in that middle fat pad right here, again with the frontal branch sitting in this mesotemporalis. And now we're going to go ahead and dissect out the frontal branches, which lie directly deep to the temporal parietal fascia in the subSMAS plane. So here we've defined the plane of the frontal branch, just so you understand. Subgaleal, and here is where we've incised the superficial layer of the deep temporal fascia to protect the frontal branch. Now if you look, the frontal branch is on Pitangay's line going directly toward the upper brow. See it right there. And it's encased in this subSMAS fat. So to expose it, I had to go through the SMAS, which is here, into the subSMAS fat, and then on the undersurface of the subSMAS fat lies the frontal branch right here. And then this here is galea. And you can see why dissecting in this region in the subgaleal plane puts you juxtaposed to the frontal branch, while dissecting beneath the superficial layer of the deep temporal fascia here, come out, gives you another layer of protection.